All right, so thanks so much, Phil, and thanks to everyone at the MassME CFS organization for asking me to do this, especially my dear friend Carol. It's been really a pleasure working with you and putting this panel discussion together. So I'm just going to give you a quick overview to get us started for the afternoon. So the National Institutes of Health is one agency within 11 within the Department of Health and Human Services, and NIH invests $41.7 billion annually in medical research for the American people. And these are the fiscal year 2020 figures. We're currently in the midst of our year-end audit for fiscal year 2021. But about 80% of the funds are used to support more than 50,000 competitive grants to 300,000 researchers at more than 2,500 universities, medical schools, and other research institutions in every state, and actually also in some foreign countries. And this is what we call our extramural research, or funding that goes out to institutions outside of NIH. About 10% of the funds are used to support research at NIH, which is what we call intramural research, or research that's done actually on the NIH campus, either in Bethesda or at one of the other locations. So I just wanted to share with you the funding, this graph that shows the funding for ME/CFS research that really took a big jump in 2017 when we funded the 3 collaborative centers, as well as the Data Management Coordinating Center, and has stayed somewhere around 14 to 15 million since that time, with some then investigator-initiated grants, what we call R01s or R21 grants, sort of starting or ending. And we really are trying to work very hard to try to get this number to grow with more applications coming in, and really working with the investigators to get to submit applications that can be successful through the peer review system. So for today's panel, you'll be hearing from 5 different individuals. So just again, to make the distinction, you'll first hear from Dr. Avindra Nath, who is our clinical director at NINDS, and he works in the intramural division within NINDS. And then you'll hear from the 4 individuals who are funded through the centers, Dr. Ian Lipkin, Durya Unitmats, Maureen Hansen, and Dr. Bateman, who all will provide information about ongoing research in the centers. So just to talk about the centers and the Data Management Coordinating Center, this is a diagram on the map that shows you the broad breadth of individuals who are part of these research centers and the Data Coordinating Center, which include individuals from the Jackson Laboratory, from Cornell University, from Columbia University, as well as partnering with the Canadian network ICAN-CME with Elaine Moreau and all of our friends and collaborators in Canada. In addition, RTI is the Data Management and Coordinating Center that helps us to coordinate things and to provide tools for the investigators to use in their research. I'll point out also that the Community Advisory Committee that Allison Canis at Columbia oversees really helps to provide information and support across the network and to work with all of us. And we're partnering with the Community Advisory Committee to actually repurpose the videos from today into a webinar series that will become available probably early in 2022. So if your questions today don't get answered, there will be another opportunity, but in the discussion period later, we'll try to get to as many of your questions as possible. So just 3 different communication and research tools that have been developed by the Data Management Coordinating Center that are really helping the network is first the network website, and all of the URLs are listed here in the middle of the slide, which really provides information and outreach that and puts out information about activities, about publications and things happening within the ME/CFS Collaborative Research Network. The RTI, or the Data Management Coordinating Center, has also developed two really very useful tools, one called Search ME/CFS, and this is a query tool that allows investigators to investigate what biospecimens are available for research. And right now, from the CFI data set and biospecimens that were collected by 5 different sites several years ago with funding from the Hutchins Family Foundation that NINDS took over from them. They were kind enough to share those biospecimens and data with us. And so individuals now can query and ask and identify biospecimens that might be available for their research and request access to these biospecimens at no fee to them. MappME/CFS is another tool that's been developed by RTI that is really designed to be a data sharing tool. There's a public and private side to MappME/CFS that allows right now, the public side is data sets from publications. They started with data mining all of the publications from the centers and are now adding in additional data sets from other publications. And there's also a private side where individuals can put their private ongoing research data if they want to compare data with another site, if they're doing a collaborative projects between sites, and it allows for them to do that data sharing in an online way that makes it very easy and for them to do that kind of data sharing. So with that, I'm going to stop and turn it back to Phil to start the panel introductions, and I look forward to coming in after each of the speakers to ask them clarifying questions and then to moderating the panel at the end. Thank you.